Hi, everyone. Thank you so much for joining us and welcome to today's webinar, The Rural Mental Health Crisis. My name is Jackie Zimmerman. I'm the Public Education Associate at Mental Health America's National Office, and I'll be moderating today's webinar. I have a few notes before I introduce our topic and speaker for today. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but if you'd like a certificate of attendance, we have a form for you to request one. I'll be posting the link to that in the chat here shortly, and it'll also be included in your follow-up email. We will have a little bit of time at the end today for questions and answers with our wonderful speaker. So please feel free throughout the presentation to be asking those questions in the chat. We will be collecting those as we're going through and then have some time at the end to go through a few of the questions that you all have for us today. So we greatly appreciate chat use. Feel free to post your questions in there. Also to add any comments, any knowledge. We always love when you all are sharing your knowledge and resources in the chat as well. So recently, MHA has been working in partnership with Rural Minds to provide you all with a new resource and some more information regarding this topic of rural mental health. We have co-branded a fact sheet with Rural Minds that gives some information about the current mental health crisis in our rural America. And so that tool is available for download. I will also be posting the link to that in the chat. And a lot of the information that we'll be going through today is discussed in there as well. So we highly encourage you to download that and also check out each of our websites. I'll be posting the link to Rural Minds in there as well, which leads me to introduce our wonderful speaker for today, Jeff Winton. Jeff is the founder and chairman of Rural Minds, a nonprofit organization with a mission to serve as the informed voice for mental health in rural America and to provide mental health information and resources. When his nephew, Brooks Winton, died by suicide in 2012, Jeff's late mother, Elaine, who helped raise Brooks, courageously ignored the guidance of some local community members and urged Jeff to speak at the funeral about Brooks's struggle. An outpouring of support and hearing from other farm families about their own struggles around mental health convinced him to devote a significant portion of his energies to connecting rural Americans to much needed mental health services. In addition to being the founder and chairman of Rural Minds, Jeff is the founder and owner of Wall Street Dairy, a working family dairy farm in Chautauqua, I hope I got that right, County, New York, and a member of a multi-generational farming family. He's worked 4 decades as a communications and corporate affairs leader with Fortune 100 corporations and respected public relations and advertising agencies. This global experience spans highly diverse and dynamic industries, including the pharmaceutical, biotechnology, animal health, agricultural, and consumer arenas. Jeff is also Chief Executive Officer at Jeff Winton Associates, a full-service communications and corporate affairs agency he co-founded in 2020. He has deep experience on both a professional and extremely personal level, with efforts to educate about depression, bipolar disorder, schizophrenia, substance use disorder, and other forms of mental illnesses that have led him to create Rural Minds. Welcome, Jeff. We are so grateful that you are able to be here with us today and share. So I will turn it over to you and let you take it from here.
Well, thank you very much, Jackie, and I appreciate that very generous introduction. I'm very impressed that you could pronounce Chautauqua, because even people here in the area can't pronounce it. It's actually a Native American term that means bag tied in the middle. And there's a lake that I'm looking at right now near where our farm is here that looks like a sack that literally was tied in the middle. So I'm very impressed.
It must be the Wisconsin in me, because we have many similar names. So I tried my best there. I'm glad I got it.
Yes, well, I'm very, very impressed. And I'd like to thank Mental Health America for giving us this opportunity. We're very humbled and very honored to be talking to all of you today, especially since by comparison, we are a new organization. We were just launched a year ago. So I represent the 60 plus million people across the United States that live in what is considered rural America. And a common definition of rural America is any town of 2,500 or less. And believe it or not, 95% of the population in the country of the landmass is considered rural. But unfortunately, the spotlight all too often on many issues, including mental illness, is seen more in urban and suburban settings, and hence the reason for Rural Minds. So I've got a few slides I'd like to go through with you today. My colleague and our executive director, Chuck Strand, is with us driving the slides because I'm not always the greatest multitasker, and I was afraid if I was going to be doing the slides and talking, there could be a mini disaster occurring. The one thing also at the very beginning, which is germane for the topic today, I will apologize in advance if I have any broadband issues. Again, as Jackie said, I'm talking to you from our farm in upstate New York, a very rural area, and it's storming out right now, which always concerns me, especially when I'm doing something like this, because the broadband issue is all too prevalent in rural America, as many of you know. Chuck, let's go to the next slide, please. So as many of you may know, compared with their urban counterparts, rural Americans have higher depression and suicide rates, but are much less likely to access mental health care services. And I should also mention that this presentation is focused on the emergency we're facing here in the US. I saw when you were signing on that we have a number of people from countries all over the world. And I apologize that I'm not addressing this from a global standpoint, but as I think you will appreciate and understand, many of the issues that we face here in America, especially in rural areas, are very common, and you experience the same thing in other countries around the world. Chuck, next slide. This is just a shocking statistic that is relatively new. And in the partnership document that Jackie mentioned that we have with MHA, you will see this. In rural counties, the suicide rate is between 18.3 and 20.5 per 100,000 residents, compared to large urban areas where the rate is 10.9 to 12.5, which again, I'm no mathematician, but people on our team that are did this calculation that's a 64 to 68% higher prevalence than it is in urban areas, and hence the reason we were founded a year ago. And there's many reasons for that we will be going into next. Chuck, next slide, please. So this is my big strapping nephew, Brooks, who Jackie kindly referred to in the introduction. Brooks, you can't really see in this photo by design because for confidentiality reasons, we removed his twins. But in this slide, which was taken a week before he died by suicide, he took his then 3-year-old twins, and he's got one on each shoulder, to Niagara Falls, which you may see in the background. We live about an hour and a half from Niagara Falls, and he evidently had been planning this unbeknownst to us for some time and wanted to take his children while they were old enough to appreciate Niagara Falls to the falls while he was still alive. So this was literally taken a week before we found him after he had died. His twins are now 13. This took place 10 years ago. I'm actually having dinner with them this weekend. They live up here near our farm, and they're just the most delightful young people who we have now had the conversation with about how their daddy died and why he died, because we wanted to make sure they heard from us rather than a bully in school who might have made this an issue. Plus, with the launch of Rural Minds a year ago, we wanted to be able to talk openly and transparently about what happened to their father, my nephew. So this is really a story of my family, and we have a video that's on our website that you can take a look at, but I decided rather than showing the video, because this is a very personal story for me, that I would do the story without the video on this call today, especially since we've got ample time for me to tell this story. So we had gathered as a family 10 years ago for the marriage of Brooks's oldest brother, Toby. He was the first in that generation to get married, and it was a really beautiful weekend, not only weather-wise here in upstate New York, it was in September, but it was just the type of event families look forward to, especially a happy, joyous experience like a family wedding. So his oldest brother was married. It was a beautiful wedding. The reception was at the rodeo grounds nearby, which those of you who live in rural America know that we have wedding receptions in different types of places than people in cities and suburbs do. So this was at the rodeo grounds. And as we were leaving the wedding reception that night, Brooks, who was 6'8" and 320, big, burly guy who was stronger than anyone I've ever met, gave me a big hug and basically thanked me for everything I had done for him over the years, because he was raised by my parents. So he was really more of a brother to me than a nephew, because we were raised by the same two people. But I didn't really think much about it, because he was a very grateful, very gregarious, very appreciative young man who knew no strangers and was always the first to thank somebody for something that they had done for him. So the next day, I go about my duties on the farm. And the following day, I was getting ready to head back to the Midwest where I was living at the time. And Brooks and I kind of had this little routine where we would stop at the family cemetery where generations, multi-generations of my family are buried. And whenever either one of us was there, we would send a selfie to the other to basically say, hey, buddy, I'm here, I'm thinking about you. The family all says hello. So I sent him the selfie, texted him, and I didn't hear anything from him. And I thought, well, he's probably tied up with the twins. Maybe he was at work. I wasn't sure, why there was no response, but I wasn't overly concerned. Until 5 minutes later, I left the cemetery. And as I approached his house, there were police cars everywhere with their lights on. And I pull my truck up wearing my barn clothes, and on a dairy farm, you get pretty dirty while you're doing your morning and evening chores. And I jump out of the truck, and one of the neighbors comes running across the country road and grabs me, crying hysterically, and just said, Jeff, I don't know how to tell you this, but you need to hear from someone, and I don't want you to see this. But I just found your nephew hanging from a tree in the backyard. Even 10 years later, I still get choked up about that day. And it was a surreal moment. And our mind immediately went to, well, where are his twins? Where are the 3-year-olds? Where are their mom? And so the police broke down the doors to make sure that the kids were okay. And the babies weren't there. They were with their mom shopping, evidently. And Brooks had planned this and waited until the mother of the kids had left with the babies. We had no idea that he was struggling with any form of substance use disorder or mental illness. Again, he was a very happy, very gregarious young man. We had been worried about another family member who had been attempting suicide for a number of years. So the family's attention had all been on that individual, never in a million years thinking that it was actually Brooks who was the one that was suffering in silence. So when he died in our town of 500 people here in farming area of New York State, we had a number of family members and a number of even close friends who said to my mom, well, you're not going to talk about this, right? You're going to say he died of natural causes. Keep in mind, he was 28 years old and very healthy. He had a farm accident. You're going to make up a reason, right? And my mom, who is a very quiet but very courageous woman, sat in the study of that small town United Methodist Church with tears running down her face and pounded on the pastor's desk and said, of course, we're going to talk about this. She said, it's about time people confronted what's been going on up here for years. For some reason, people don't feel comfortable talking about when people die of suicide. They don't feel comfortable when someone's struggling with major depression or bipolar disorder. But that's going to stop, and it's going to stop with our family because we owe it to Brooks to make sure that this doesn't happen to any other families in this area. So 2 days later, his funeral took place. Hundreds and hundreds of people filled this little country church. It was standing room only because it's a very close-knit community, because my family has been here for multi-generations, and because he had so many friends from all walks of life, not only young people like himself, but people that were much older than him that he had befriended. As I said, he knew no strangers. So after the funeral, we had people lined up to talk to my family for hours, literally for hours, with tears in their eyes, not only expressing their condolences, but giving us their story, sharing with us what had happened in their own family, families we had known our entire lives, telling us their own personal story about their own struggle, and basically saying, thank goodness somebody finally took the step to start talking about this, because it's now giving me permission to tell somebody my story, something I've never felt the ability to be able to do because I didn't want to be judged. I didn't want to be a burden to my family. So 10 years ago, the seed for Rural Minds was first planted with my nephew's death. But as Jackie said, I was working in the corporate world at that point, and I had the privilege of working for biopharmaceutical companies, many of whom were dealing in the mental illness space. And so I was able to make a lot of connections and really talk to a lot of groups, including Mental Health America, about, is there really a need for a group that's focused on the people that have been forgotten, the 60+ million people that live in small towns, that live on farms and ranches, that live in mining towns and fishing villages and other rural communities. And the resounding answer was yes. We have been so focused on urban and suburban audiences and people struggling in those communities. We really haven't spent too much time talking about people in rural America, nor, quite honestly, do we even know how to reach them. Because one thing many of you may know who are also from rural areas is that the way you talk to somebody that lives in a more rural area and the way you reach them and how you reach them may not be the same way as what you do if you're trying to reach somebody in Los Angeles or somebody in Miami or someone in New York City. So we've spent the last 10 years up until we launched last October to really make sure that we were filling a need and that we weren't duplicating efforts on the part of other groups and other organizations that exist out there. Next slide, Chuck. So the mission of Rural Minds is to serve as the informed voice of mental health in rural America and to provide mental health information and resources. So we're only focused on rural America because we honestly believe that other non-rural communities are being adequately addressed as far as programming and resourcing is concerned. But what we're attempting to do is to shine a light on this growing pandemic that will be a pandemic long after COVID has been resolved, by the way, and to get the resources in the hands of people that we represent in a language that makes sense to them and delivered by trusted messengers in the community. So this is our premise. We're not developing a lot of new programs or support groups or anything like that, but our goal is to make sure that the people we're representing are aware of the resources that exist. Our website has a whole section on many of those resources that we have been congregating over the past year to make it easy for the people that we serve to find these resources as a one-stop shopping type proposition. Next slide. So our vision is a rural America where there's no more silence, suffering, or stigma around mental illness. Stigma is a huge issue here in rural America. Again, I'm from here. I was raised on a farm. I now live on my farm. I'm a small town guy who just happens to have lived in some big cities over the years. And in fact, when we launched this, I decided if I was going to be serious about running an organization representing people in rural America, I needed to be back living in rural America. So in December of last year, I moved back to this farming community where I'm talking to you from. And I can tell you that the stigma that exists today has not changed much from when I was a young man. And that was several decades ago, as you can probably tell, looking at my gray hair and balding head. The stigma is something that we are really focused on because our goal is to get people talking about what's happening in any given community, just like my family did 10 years ago when my nephew died. Even if it's one person, if they can confide their story in one person, that's where the healing begins, not only for the individual who is suffering, but for the community that's been so tragically impacted, like our community was when my nephew died. And we'll talk about this a little more moving forward. Next slide, Chuck. So these are just some statistics that, again, you can see on our website, but these are some of the barriers that we deal with here in rural America. Nearly 3/4 of rural counties in this country lack a psychiatrist, including where I'm talking to you from today. If my nephew had wanted to go to a psychiatrist, he would have needed to cross the border into Pennsylvania, or he would have needed to drive 70 miles to Buffalo, which is another more urban area, of course. But we don't have any psychiatrists in this area anymore. 81% of our rural counties don't have a psychiatric nurse either. So having access to care, even if people are willing to get it, is something that we are going to be tackling moving forward as a new organization. There's also a huge issue with the lack of primary care physicians. When I moved back here in December, I started reaching out to primary care physicians in the area to see who I could start to visit on a regular basis. It literally took me 6 months before I could get in to see anyone here in a rural area because there weren't enough physicians or even nurse practitioners or physician assistants to see someone on a regular ongoing basis like I was looking for. The other thing, as I mentioned at the very beginning of this talk, nearly 3 in 10 rural Americans, 28%, do not have broadband internet at home. And even those of us who do have broadband, it's far from ideal. It fails us on a daily basis. And you are always hoping and praying every day, especially during a time like this where I'm so dependent on the internet, that I'm going to be able to do what I do for a living, which is talk to people like you. So the infrastructure bill that has been passed, that's being implemented in Washington, will certainly help to start addressing some of this issue, but it's going to take years before rural America has the appropriate broadband. So as you can imagine, telemedicine isn't necessarily a panacea in rural America, like it may be in more urban and suburban areas. If you don't have internet service and don't even have adequate mobile cellular service, you can't talk to somebody or get a consult, especially if it involves a video or a something besides audio. So telemedicine, while it has promise and will eventually be more utilized here in rural areas, it's still far from ideal, and we have a lot of work to do. Next slide, Chuck. So this slide I know is difficult to read, and I apologize for that. And we are breaking this for future meetings into 2 slides, but I've addressed some of these things before, but just quickly, people in rural America are raised to be taught to be self-reliant. We're taught to be independent. We're taught not to talk about our problems. We're even taught not to cry, not to show any emotion. So something like living with depression or living with schizophrenia or bipolar disorder is certainly something that many people in these areas do not feel comfortable talking about, because unfortunately, it's not even looked at as a disease. Mental illness in many rural areas is still considered more of a personality weakness, a character flaw. It's not looked upon as the illness it is, like cancer, like diabetes, even COVID. People are readily talking about their COVID diagnosis now. If you have cancer, you don't try to hide that. You talk about that. No one is really talking much about mental illness in rural areas. So that's one of the first things we need to tackle. One of the other things is lack of trust in anyone to maintain confidentiality in a small, close-knit community. I often tell people that the best thing about living in a small town is that everybody knows your business, because when you have a family tragedy like my family did, everyone rallies around you and provides you with support. The worst thing about living in a small town is that everyone knows your business. And if there's something that you're not necessarily comfortable about having known to the rest of the community, it's hard to hide that. People find out about it. If you do go for help, even if there is help, everybody knows everybody's car or truck in this case. And if they see your pickup truck sitting in front of, the local mental health provider or the local chapter of MHA, the word gets out that, Farmer Brown is having evidently some type of a mental health issue. So confidentiality is a big issue, which ties into the next one, the fear of negative judgment, because again, it should be something we should be able to get over on our own, to pull ourselves up by our bootstraps and not need any medical intervention. Getting an appointment is difficult. As I said, there's limited resources to start with. And many people that work in rural areas tend to have more blue and working collar type careers where they're 9 to 5, if not, farming is pretty much a 24-hour proposition. You can't necessarily just leave your office setting and go to a doctor's appointment and come back. It's hard to get away from a farm, from a lumber mill, from a feed store, from whatever the type of work a person is. And even if you do, you may have to drive, a couple hours. In the case of states like Montana, the Dakotas, where some of you may be from, you may have to drive 4 or 5 hours to get to the nearest healthcare provider. The time and transportation I just talked about, the internet we've talked about, health insurance is a huge issue. People are either uninsured or underinsured in many parts of rural America, including here in our own small town. And I even have some family members that are underinsured. So if you have limited insurance or insurance that, you've got such a big copay, you're going to save that for a more physical illness than you are for something like your depression or your schizophrenia. Isolation is a big problem in rural America. People who don't live in rural America look at it as a beautiful, very bucolic, very peaceful place to be. And trust me, it is. I'm looking out the window right now at our cattle out on the pasture here on our farm, and it's very tranquil. But it can be very lonely, especially in the wintertime in an area like this where you've got several feet of snow and you can't necessarily go anywhere. And COVID exacerbated that because people weren't able to go to school. They weren't able to go to their local church or their local Grange meeting. And so isolation has become an even bigger issue in rural America. And last but certainly not least, as a farmer, I know this all too well, is that the weakening agricultural economy has had a major impact on farming towns, not only for the farmers themselves, but all the other services that support an agricultural community, whether it's a veterinarian, whether it's a feed dealer, whether it's an equipment retailer, even small diners and things of that nature. If the farmers don't have enough money even to feed their cattle, in the case of a dairy farm like ours, they're certainly not going to be able to buy a new tractor or take their family out for a nice lunch after church. And the agricultural economy has been plummeting for a number of years. This is nothing new, unfortunately. Next slide, Chuck. So COVID is something that, as I mentioned before, has really exacerbated not only things in rural area, but also in suburban and urban areas. And I won't go through these statistics because, again, they're on our website, but rural people impacted 3 of 5 rural adults, and 2/3 of farmers and farm workers, the American Farm Bureau did the survey, have been impacted already by COVID in some way, shape, or form. And it's, it caused an increase, according to the National Institute of Health, since it's been tracked in 2020, especially again here in rural areas. Young people, as many of you know, who are young people or recognize and work with young people, it's on the rise, especially amongst 15 to 24-year-olds, people who tend to be very social, who want to go to homecomings, who wanted to go to their class trip, who weren't able to do that up until recently. So again, I won't belabor this point, but COVID has only further complicated the issue we're dealing with in all segments of the world, but certainly here in a rural community. Next slide, Chuck. So these are some of the things that we are doing at Rural Minds. We're certainly listening to rural Americans who are willing to share their story. I gave a speech at the New York Grange meeting on Sunday in central New York. It was their 150th anniversary meeting. And after the meeting was over, and there were a couple hundred people there, I again had a number of people follow me out of that ballroom to tell me their story, including some very recent issues that some of them were experiencing, and they just felt, again, relieved that they had someone to talk to, and they had an organization that now represented them, since the Grange has very deep roots in rural America. As I said before, our goal is to connect people in rural America to existing resources, including MHA support groups. We're not trying to replace them, certainly. We're trying to identify the gaps that exist in rural health information. And that was one of the reasons we were so excited about partnering with Jackie and MHA on this new fact sheet that we have that specifically addresses mental illness in rural America. We're collaborating with mental health nonprofits, including MHA, NAMI, DBSA, on a national level, but also many local and state organizations, including grassroots organizations, and even many for-profit companies, not only in the biopharmaceutical space, where the companies may be making medicines for people living with various forms of substance use disorder or mental illness, but also agricultural companies that are very concerned about the rise in this issue with the people that buy their products. And then again, we're just really looking across the panacea of things that exist to see what new things need to be developed. And for 2023, we've got a number of things that we're working on as part of our strategic plan. Next slide, Chuck. So we are, Rural Minds is working to eliminate the stigma, again, to recognize that it's an emergency, to normalize conversations, to make sure that people understand that this is something that they should feel free to talk about. And as I said before, recognizing that mental illness is in fact an illness. Next slide, Chuck. I think we're going to skip this slide. We've already talked about that. So let's go to the next slide. This is on our website. So this is what I wanted to showcase, especially since MHA was so kind to invite us to this webinar. This is the piece of collateral information that I mentioned that has some of the statistics in here that I've already gone over. And so this piece will be finalized and developed and distributed very soon. In addition to this piece that MHA has developed in conjunction with Rural Minds, we also will be hosting and have hosted a number of rural health connection webinars. We've had a number already. You can find them on our website. They are free. We invite you to future ones. We invite you to go to our website. We have a newsletter that goes out on a regular basis. As a matter of fact, our latest one just went out on Monday. We have a number of initiatives underway with other companies that you'll be hearing more about moving forward. We're doing a program with the National Grange, who is our very first partner on rural suicide awareness and prevention. And for those of you who aren't familiar with the National Grange, it is a wonderful, very large, very old organization that's been around since the mid-1800s that represents rural America better than almost anyone I know. Many of you may have seen Grange Halls. You may have gone to Grange Halls. I know I certainly did. I tell people that's where I learned to square dance. That's where my 4-H meetings were held. That's where I took dog obedience lessons. So Grange Halls are a staple of rural America, and there's over 1,400 of these across the country. So we've got a partnership with the Grange, and I've been asked to speak to their national meeting out in Reno next month, and I'm really looking forward to that. But they've been a wonderful partner, and we're looking forward to where that partnership is going to go. Again, I've mentioned a number of the other nonprofits, and we're also doing a lot of media work. Chuck, I think the next slide has just some of the many pieces. The piece that's shown is from Hordes Dairyman. That's me getting my ear chewed off by one of our calves here on the farm. We have been going to not only the traditional media, such as Scientific American. They were doing a piece on disparities in mental health care, and they reached out to us representing people that live in rural America because they said the Black and brown communities are talking about this, other non-represented minorities are talking about this, but we've never even thought about rural Americans as a minority. And so we want to include you in our story. Hordes Dairyman, which is the piece that you see up here, is a staple of rural America. I tell people this is how I learned to read. This came to our farm a couple times a month, and kids in rural areas, regardless if you live on a farm or in an agricultural community, you learn how to read from Hordes Dairyman, and I'm so happy it's still around. We've done a number of television and radio interviews as well. And the thing that's especially striking to me is every single interview I've done, whether it's a radio, national television, or a local print interview, the journalist who's interviewing me at some point in that conversation starts to tell me about their story, starts to tell me about their sister who died by suicide, their son who has attempted suicide a number of times, and they don't know where to go for help. And on it goes. So we're spending a lot of time and effort getting the word out to media, especially the ecosystem of rural media that a lot of people don't even know exist, because this is the trusted resource. This is where many people, especially in agricultural communities, go to get their information, and they will trust a Hordes Dairyman or one of these radio stations or television stations you see listed more than they will certainly the Wall Street Journal or the New York Times. So we're trying to meet people where they are and get our message out in the media that already exists, that's already a trusted source of information. Next slide, Chuck, which I think is our last, and then we're going to open it up for questions. So I always like to end with this quote: sometimes the loudest cries for help are silent. And that was certainly in the case of my nephew, Brooks Winton. Again, looking around at the pastures and the barns across the street here on our farm, I miss him tremendously. I miss him every single day. But the work we're doing in Rural Minds is keeping his memory alive, and it's allowing us to use his death as a platform to ensure that other people know that they're not alone, that there are other people like us and my family and all the good people at Rural Minds, many of whom are on this call listening in, and I appreciate them. We have a number of volunteers that work with us. If you're interested in learning more, please go to ruralminds.org. We're, of course, always looking for donations. We are a small and new organization, so we depend on funding like all 501(c)(3)s do. But we also depend on volunteers who want to work with us in communities across this country. So please feel free to reach out to us. If you want to reach out to me directly, you see the info at ruralminds.org. My name is Jeff. Again, Jeff Winton. You can email me at Jeff, Jeff, at ruralminds.org, and I'd love to hear from you. So thank you very much for your time and attention. I know that's a lot to go over, but I appreciate your attention to this presentation, and I now look forward to hearing the questions. And I've seen dozens coming in while we've been talking, so I'm hoping many of them are questions and not messages to me telling me to move along and get my presentation done. So Jackie, I look forward to hearing what people have on their minds today.
Yeah, absolutely. First, just thank you, Jeff. I know that I told you not to worry about looking at the chat, but I'm excited. I'll share the transcript with you afterwards, because there was such an outpouring of gratitude and support for you in sharing your story and for your family. And like you said, others sharing their stories. And that is part of this overall mission of Rural Minds and at Mental Health America, to be breaking that stigma and really just making sure that we're having these important conversations. And So I just thank you for the last hour we've had, but we have had some really great questions. And
Great.
to go along with that, the first that I do want to talk about is the stigma piece, because lots of people were sharing personal stories of how stigma has affected them in rural communities and the stigma they've seen or experienced themselves. And we often talk about ending the stigma or reducing stigma. But for those joining us today, what can they do personally to work towards eliminating this stigma around them?
Yeah, well, it's a very good question. And thank you for everyone who sent notes of encouragement. I look forward to reading the transcript after. And thank you for your support and the questions that you've sent in. I often make the correlation between what we're dealing with the stigma of mental illness in rural America and what happened at the beginning of the HIV and AIDS epidemic, which again, I'm old enough to not only remember, but I was very involved in. It was one of my very first corporate jobs working for a pharmaceutical company. And, AIDS back when it first started was highly stigmatized. And it was something that was not talked about in many areas, not just rural areas. But eventually people started to hear more about it and started to put a personal face to the epidemic. So people in urban areas started to talk more readily about it. People in rural areas did not talk readily about it until such time that they met someone from the community who was living with HIV and AIDS. Putting an individual personal face on any disease or any type of an issue is where this all begins. And that's why these stories that everyone has are so important, because once your neighbor hears your story from someone who they've gone to church with, who they've grown up with, who they may even farm in conjunction with, it starts to make it real. And it starts to make them realize, well, if this could happen to my next door neighbor who I've lived next to for 25, 30 years, it could happen to everyone. I need to start doing something about this. So again, putting that personal face on it, even if it's just one person who tells their story to their neighbor or another trusted resource, is where this all will move. And I truly believe is where the stigma is going to start to diminish over time. It's going to take a while, but we need individual stories. We're all storytellers in some way, shape, or form. That's what human beings do. That's why we have the ability to talk, and other members of the animal kingdom don't. We communicate by talking, we communicate by telling our stories. And that is, to me, in my humble opinion, and again, I'm not an expert after only a year, and I'd love to hear other thoughts of other people that I can learn from. But I really do believe in our experience, both my family's experience as well as other experience we've had in the past year, that telling those personal stories that aren't easy to tell. You see, even me, 10 years later, I still get choked up, and I hope I always will, because that means it's still important to me. It still has touched me at the very core of my existence. But those of you who have a story to tell, whether it's your own or your family, you don't have to do a webinar in front of 700 people like this. You don't have to go on national television like I have, but talk to someone you trust, whether it's your pastor, whether it's your school counselor, somebody, because I can guarantee you, you're going to feel a lot better about it, and you will have touched at least one other person. And this grassroots movement is what Rural Minds is all about.
Absolutely. Such important points made there, Chuck and Jeff. Oh my gosh. But I think one thing that really stuck out is just having those conversations. And I know that in the chat, I was reading a few messages from people throughout the presentation and saying, that they've tried to have these conversations and received that pushback, or that's something we don't talk about, or that's not a problem that we deal with. And I know that that was a part of your story too within your own community. And your brave mother said, no, it is time to talk about it. And so that's something that we can have the courage to do too, to start breaking this stigma, is to, use our voices. And when that fear and those negative thoughts and feedback are shared with us, you know, pushing against them and trying to continue the conversation and say, well, no, it is something we're experiencing and something that many are experiencing and something that I might be experiencing. And I need help and I need to be heard. And so I think that's just such an important point, and really one of the most powerful parts of your story as well, that your family has taken on this determination to fight the stigma that's so prevalent. And it's really hard, it's challenging, because it has been a part of rural life for so long that it doesn't just change in a day or in one conversation or in two conversations or in 20 conversations. It is going to be something that we need to keep pushing back against and working
Yeah,
towards.
no, that's absolutely right. And, to me, the hope in all of this are really the young people who are being impacted more than other parts of our society. Young people tend to talk about tough topics more than certainly me as a baby boomer does. And so I am hopeful that a lot of the young people who sadly more than likely know someone who's died by suicide, and maybe have even had a family member, that they're going to be the ones out there helping the older generations, such as my generation, to understand that this needs to be talked about. The other thing I would say, with people pushing back and saying, well, this is something we don't talk about, sometimes it's a matter of just hearing them out and listening to them and asking them some questions about why they don't think it should be talked about, and really turn the tables on them. Because through that two-way dialogue, my experience has been something will finally hit home with them, something that they may say themselves, where all of a sudden a light bulb goes on and they'll say, you're absolutely right. The other thing I would say, there's all kinds of obstinate people in this world. If your message is falling on deaf ears, find another set of ears. There's plenty of people out there that are more willing and open to hear the story. We can't convert everyone. We can try, but if you don't get through to a certain individual after trying some of the techniques you've talked about, Jackie and I have, then you move on and you find another willing participant, somebody who is more open to hearing the story.
Absolutely. I couldn't agree more. I think that's such a great, a tactic, is to ask, well, why isn't it something we talk about? So you really can better understand. And for so many of the adults, if it's a youth coming to a parent or someone and that's what they hear, it's hard, because that is what that adult has grown up with their whole life. And so challenging those thoughts and just structures of this is how life is hard for them too. But you can imagine how difficult that is for someone to hear that, their struggle isn't being validated or heard. And again, another great point of, there is someone who will listen, and finding that person and knowing that if you go to someone at first and they don't give that support and help that you're seeking, someone else will. And so not giving up hope and not, losing the courage to keep sharing what's going on and seeking help for yourself or seeking help for someone that you love, because someone will be there to respond and help.
Well, and another experience I've had is some of the people that are the most resistant to hearing the story have their own story that they just haven't been willing or able to share up until now. And they may not be readily ready when you tell your story, but what I've seen happen over the time we've been working in this is that maybe a couple days later, maybe a couple weeks later, they'll come back to you and say, I've really been thinking about what you've talked about, and I'd like to talk more about it. And in the course of that, you may hear something that you weren't expecting. You may hear about their own personal struggle. You may hear about something that's impacted their own family. So it's human nature, but your points are very valid, and certainly some things I'm going to take to heart. So thank you for sharing what you just shared.
Yeah, of course. I know we're nearing the end of our hour, but there's one other topic I wanted to quickly bring up that I know there's been a lot of discussion on throughout the chat as I've been looking at it, and a really great point made by many of you who are joining us, which is when we're thinking about this issue of lack of access to care, not enough psychiatrists, psychologists, counselors, mental health professionals in these areas, where else can people find support, and how important peer support is, and how that can play a role in rural communities? Because when we think about access to care and how increasing it is an increased problem in these rural areas, but it's a problem everywhere, and trying to combat that right now is a big initiative by those of us working in mental health, but it's again not something that will be changed overnight, and something that will take time. So in the meantime, when people are maybe on a waiting list, or if they can't travel to another area to receive care, what can they get in their communities? And I love that so many of you brought up peer support. And there are so many ways to receive peer support, whether it be groups in person. I know MHA has many affiliates throughout the US. Some of you mentioned different NAMI support groups, which are great, or even online support groups for people that do have access to online platforms. In the chat, I will post a link. MHA has a group with Inspire that is focused on different mental health conditions, where you can join the group, and those who struggle with those specific conditions, thoughts, feelings, post in there and connect with others. And it kind of gives you this community of learning from others that might be experiencing similar things to you. And so that's just one resource, but there are many out there to receive that support in other ways. Just Jeff, any thoughts on that community support model being important in rural mental health as well?
It's an excellent point. And I think, Jackie, I shared with you when we had our introductory call that MHA has a support group literally 15 minutes from my farm here. And it's something that if anybody from MHA Jamestown, New York is on, I look forward to meeting you. In some of these more rural counties, there are already existing support groups. Now, granted, a lot tend to be in more urban and suburban areas, but there are some that are starting to get formed in areas like where, again, I just mentioned. The other thing we are doing is ensuring that people have a community where they have other people that are like-minded, that they have something in common with. And that's why we're partnering with the National Grange, because the Grange already is bringing together people from rural areas that tackle many different things, such as auto safety, political things. They do a lot of lobbying work, things of that nature. And so they're already gathering to talk about other topics. And so it's almost a train the trainer type approach. We're going to be taking with the Grange and with some other groups similar to them that are already exist in rural America that may not be focused on mental health like MHA is, but they represent the people that we represent, who are already getting together with their neighbors, with their friends. So there's already that built-in trust. And so now we want to take the uncomfortable topic of mental illness into those groups, make sure that somebody is trained, and use many of the resources that MHA has already developed, for example, that can be utilized in these non-traditional support groups, where maybe a person won't feel comfortable driving into the city to meet with non-rural people, but they will, I think, over time, start to feel more comfortable talking about this with people that they're already used to having difficult conversations on other topics with.
Yeah, absolutely. Thank you, Jeff. And just one final thought. I know in the chat, many of you are wanting to be heard with your thoughts on telehealth. And I completely agree. Telehealth is opening up new opportunities to seek care, but also recognizing that in our rural communities, the issue of having broadband access and reliable internet can be a struggle for people too. And one conversation we'll actually be having next month with one of our webinars, and look out for information on this, is a conversation about telehealth and how telehealth works in recovery for mental health, some of the benefits of telehealth, addressing some of those challenges and how we can overcome some of those challenges. So thank you so much to all of you bringing up that. It is something that has greatly increased access to mental health care beyond what we could comprehend, and the COVID-19 pandemic really pushed that forward. And now many are realizing that it is a really good solution to finding care when it might not normally be available. So thank you all for bringing that up too. And we look forward to you joining us for that telehealth conversation. So thank you all for that. I know we are running over just a little bit, so I want to thank you all for being here. Thank you to our really thoughtful comments in the chat. Thank you for your questions, sharing your stories, and most of all, thank you to Jeff and your whole team at Rural Minds for the work that you have been doing and this great organization that you have started that is really going to help so many in rural areas. I know MHA is grateful for you and the work you're doing, and we're looking forward to continued work with you all. And just thank you for your time and vulnerability here with us today, Jeff.
Thank you for this opportunity. It's been great to be with you, and it was nice virtually meeting everyone else on the call. We look forward to hearing from you.
Absolutely. And I know many were interested in getting connected with you. So I will also include Rural Minds contact information in our follow-up materials that we'll be sending out so that people can get in touch with you and your organization as well. So thank you.
Yeah. Thank you, Jackie.
Awesome. Thank you all. Have a wonderful rest of your afternoon. And Jeff and Chuck, I will be in touch with you both soon.
Good. We look forward to it. Bye-bye, everyone.